In the second phase of pre-prosthetic mouth preparation, we need to be ensuring that whether there is any hindrance in the prosthetic treatment, that should be done to eliminate it for making of good prosthesis. And this should be done along with diagnosis and treatment planning, and it is done to facilitate good prosthetic treatment, and it is done after partial denture design. Now, there are a set of procedures which are done in pre-prosthetic as to relief of pain or infection, oral surgical procedures, conditioning of abused or irritated tissue, periodontal therapy, correction of occlusal plane, orthodontic correction, splinting of weakened teeth, reshaping of teeth, preparation of rest and guiding planes. Relief of pain or infection is of utmost importance because those are acute problems which has to be attended before initiating prosthetic treatment. Any carious teeth with pain or discomfort has to be attended or restored, or if it requires any endodontic treatment, it has to be done. Asymptomatic teeth with deep caries should also be excavated and filled. If there is presence of gingival or periodontal problems, it has to be attended. If there is any abscess or gingival hypertrophy, those has to be treated. Now, coming on to oral surgical procedures, the extraction of teeth. We ensure that the extraction of teeth with poor prognosis is done, and if there is any existence of residual root tissues, that has to be done. If there is any extraction of impacted tooth, it has to be made, or if there is severely malposed teeth which interfere with during denture making, it has to be removed. Now, indications for extraction are when teeth can complicate or compromise the prosthetic treatment, or when orthodontic treatment cannot be corrected to do the malalignment correction, or when teeth interfere with placement of major connectors. Radiographs are taken for identification of bone cyst, tumors, dori, exostosis and hyperplasia, and presence of bony cyst and exostosis. Presence of palatal tori can interfere with placement of denture base, thereby the support can be diminished, so palatal tori has to be surgically resected and removed before dentures are made. The similar way, presence of lingual tori in the mandibular arch can interfere with placement of major connectors or adaptation of denture base, and it has to be corrected in situations where it cannot be relieved. Muscle or frenal attachment should be examined when these attachments are near to the crest of the ridge. It has to be removed or reattachments have to be done. So, a procedure which is called as frenectomy has to be done. The ridges should be palpated for bony spicules or presence of any knife-edged ridges, and if the soft tissues are having any pathological lesions or flabby tissues, those have to be corrected. The existence of dentofacial deformities like cleft lip has to be surgically corrected before coming for prosthetic treatment. Alveoloplasty or alveololectomy can be required if there is any sharp ridges, or if there is any interseptal or interradicular bone which has to be corrected, or radical problems like augmentation of bone in the horizontal or vertical positions, it has to be meant. Simple alveoloplasties can also be done, and conditioning of abused and irritated tissues should be done before impression making, so that the tissue contours may change according to tissue healing. The causes for abused or irritated tissues is presence of ill-fitting dentures, or presence of nutritional disturbances, or it occurs more frequently with diabetes patients or those with blood dyscrasias. The symptoms are, it can cause inflammation and irritation to the soft tissues of denture bearing areas, distortion of the normal anatomic structures like incisive papilla, rugae and retromolar pads can occur. Patient could be experiencing a burning sensation in the residual ridge area and in the contiguous structures like tongue, cheeks and lips.